Changing an IV catheter, tubing, and dressing. Changing and dressing an IV catheter. Dressing to PIVC sites are the first line of defense against infection and dislodgements. The dressing must be kept secure, clean, dry, and intact. Indications for dressing change: when it becomes insecure or if there is blood or fluid leakage under the dressing. Determine the need for an assistant considering patient age, developmental level, and family participation prior to the procedure. If patient is allergic to transparent film dressings, use sterile film dressings to be used and changed daily. Carefully remove the old dressing, holding the cannula in place at all times. Take the opportunity to thoroughly inspect the site of entry of the cannula for any signs of infection. Skin preparation using alcohol and 2% chlorhexidine is the preferred solution for dressings. Cleanse the area around the catheter insertion site, including under the hub, using a pattern which will ensure entire area is covered. Allow skin preparation to air dry prior to applying any dressing. This allows the disinfectant to work. Consider placing a small piece of sterile cotton wool or gauze underneath the hub of the cannula to reduce pressure. If desired, place sterile tape over the hub of the device before placing the transparent dressing. Cover the cannula insertion site with sterile transparent semi-permeable occlusive dressing. Place using an aseptic non-touch technique over the catheter. This will allow continuous observation of the site and to help stabilize and secure the catheter. IV board splints are recommended to secure PIVC placed in or adjacent to areas of flexion. This will adequately immobilize the joints and minimize the risk of venous damage resulting from flexion. When using splints, ensure these are positioned and strapped with the limb and digits in a neutral position to prevent injury from restricting blood or nerve supply and to prevent pressure sores. Inspect the splint at least daily and change if soiled by blood or fluid leakage. Cover with non-compression tubular bandage. Ensure there is a clear window where the cannula enters the skin insertion site, so the site can be regularly viewed. In summary, when dressing a peripheral IV cannula, ensure that it is secure, the site is visible, the child can't injure themselves or be injured by the connection, the child can't remove or dislodge the cannula, tapes are too tight or restrictive, tubing an IV catheter. Intravenous fluids are administered through thin, flexible plastic tubing called an infusion set or primary infusion tubing or administration set. The infusion tubing or administration set connects to the bag of IV solution. Primary IV tubing is either a microdrip solution administration set that delivers 10, 15, or 20 ml or a microdrip set that delivers 60 drops or ml. Microdrip sets are used for routine primary infusions. Microdrip IV tubing is used mostly in pediatric or neonatal care, when a small amount of fluids are to be administered over a long period of time. The drop factor can be located on the packaging of the IV tubing. Primary IV tubing is used to infuse continuous or intermittent fluids or medication. It consists of the following parts. Back check valve prevents fluid or medication from traveling up the IV. Access ports used to infuse secondary medications and give IV push medications. Ruler clamp used to regulate the speed of or to stop or start a gravity infusion. Secondary IV tubing, shorter in length than primary tubing, with no access ports or back check valve when connected to a primary line via an access port, used to infuse intermittent medication or fluids. A secondary tubing administration set is used for secondary IV medications. So this is the IV primary and secondary tubing setup. Also, please note the parts. IV solution bag should have the date, time, and initials of the healthcare provider marked on them to be valid. Add-on devices should be changed every 96 hours. If contaminated when administration set is replaced or as per agency policy. Intravenous solution and IV tubing should be changed if IV tubing is disconnected or becomes contaminated by touching a non-sterile surface. Less than 100 ml is left in the IV solution bag. Cloudiness or precipitate is found in the IV solution. Equipment, date and time is outdated. IV solution is outdated 24 hours since opened. Primary and secondary administration sets should be changed regularly to minimize risk and prevent infection. Change IV tubing according to agency policy.